Welcome to the Psych Health and Safety in Canada podcast. I'm your host, Marianne Baton. And today I'm really pleased to welcome a friend of mine, Nathan Kolar, who is a corporate wellness consultant. Nathan works in many different areas, including as a longtime volunteer with the Ontario Healthy Workplace Coalition. And he was the person that stepped up and helped me create the whatnow.support website when this pandemic started. And we decided that a lot of people were losing their jobs, but a lot of people were dealing with loss of their friends at work, their routine. And so together we created this resource that is available for everyone. So Nathan, welcome to the podcast.
Thank you, Marianne. This is amazing. As someone who always listens to podcasts, to now be on this end of it, certainly grateful for it and excited for this conversation.
Yes, well, I'm really happy to have you here. So Nathan, tell me how you first learned about psych health and safety.
Okay, so I first came across it as I've been working in the workplace health field for the last number of years. And so workplace health will be all about creating programming and policies in order to create a healthy workforce, right? Healthy people, more productive people, and then even in terms, especially in the United States, medical costs for organizations. And so when you look at all the different best practices for workplace health programs, and I keep reading books and looking at articles and talking to individuals over the years, one thing that stuck out that would always be published is the idea of workplace culture matters so much for effective workplace health programming. So if you want an effective workplace health program, you have to first have a healthy and happy workplace culture. And so that was the first part of, okay, workplace culture matters. And then as I would learn more about workplace culture, again, reading more books, that same pattern, talking to individuals, doing research, it'd be like, okay, what is a healthy workplace culture? And I come across a number of resources that would reference psychological safety and psychological health and safety in the workplace being a part of a healthy workplace culture. So that's how it kind of came in as, okay, so if I identify as a workplace health or corporate wellness professional, this idea of workplace culture and psychological health and safety fitting into that really does matter. They connect.
Yeah, and
And they're synergistic.
Exactly. And so you started, I think, with the Ontario Healthy Workplace Coalition even before psych health and safety became the big thing that it is. Tell me a little bit about your work there.
Yeah, for sure. And even and that's why the kind of my involvement in this space, I guess you'd say, is really organic for sure, because even going into workplace health, it was, as somebody myself with a health and fitness background, kinesiology, it was like, okay, what am I going to do in this world? Okay, I want to make people healthy. I'm simplifying this to get the point across. Want to make people healthy? Okay, people might not be healthy because of time. They lack time. Okay, they lack time because they may always be work. And so how can we get over the time barrier? Let's target health where people spend 1/3 of their waking hours, which is the workplace. So that was the initial kind of thought process about why workplace health, why corporate wellness. And so at the time, I kind of came across this when I was working two part-time jobs. And so here I was working these two part-time jobs and then kind of doing my own personal development, realizing, okay, this idea of workplace health, corporate wellness is fantastic and can be really effective for individuals. How am I going to do that? And so of course you're applying for jobs and you're just, it's not an easy thing, right? As somebody, especially who's not involved with the industry just yet. And so one of the strategies I tried to do at the time was, okay, how can I at least volunteer in the industry? So I found the fantastic group, the OWHC, and it would reach out to them, hey, do you have any volunteering opportunities? And the answer was yes. And I started off doing all their social media with them, so social media marketing, and that grew into event planning. And then even most recently doing things like hosting the focus groups. And then as well as one of my favorite parts is anytime different governments like the Canadian government, or we've even done the American government, has created like requests for information where they'll say, hey, we have this initiative we're working on. We want to reach out to different entities and see what type of input people can give us. And many times actually on workplace mental health and psychological health and safety, been involved with that too. So just sharing different ideas with them through the OWHC. But that's how it originally came about, was okay, love this industry, but how can we get involved with this industry? And it came about kind of volunteering and trying to give back.
Yeah, I don't think anybody could accuse you of being lazy. One of the things that has always struck me is your thirst for more knowledge, your curiosity about different ideas and how they intersect. And so one of the things that I really wanted to ask you, because of conversations we've had before, is what are some of the biggest aha moments you've ever had in this field? Because I know you've got a million ideas going on in that head of yours. So
Yeah.
what have been the things that have most surprised or engaged you?
One of them, Marianne, so I'll begin with, was a conversation with yourself that I remember. And it was when I had asked you, it was along the lines of, hey Marianne, these people say this, these people say this, someone else says this, and it was all related to kind of, workplace culture and organizational health and health and safety. And then you mentioned to me along the lines of, okay, Nathan, well, if you're finding it from different areas like that, it might be what we might call like a universal truth, right? And so that's when it was like, okay, yeah, like when you perhaps when you break things down, it's like, yeah, it's you see it in different areas, because in a good way you see in different areas because it's like a universal truth. And that to me was like, okay, in a world that keeps changing and change here and change here, I'm going to try to follow as much as I can the universal truths, because those will never go out of style. They'll always be
Yes.
relevant, and they kind of get at who we are as a human being, right? And I think that was one of the things where it's like, okay, if I'm gonna have a ballpark strategy for life, it's going to be, okay, there's shiny objects here and there's shiny objects here, but what are the universal truths?
Mm-hmm. And so tell me some of the universal truths that you've found so far.
Yeah, and it's the idea of, and I've heard this before, and sometimes when I advocate for my own personal corporation, when I'll say that people are human beings, not human doings. And so it's the idea of like, okay, as people are working, their emotions and managing factors like that matter. It's like they don't matter until they do matter, right? And so that's one of those things where it's like, as how can we leverage this amazing human experience to make people their best selves? In my case, most of the time, especially professionally, it's been, okay, we can make people their best selves through a health and wellness lens. That's
So
how it
what do
started
you
with myself.
say to employers who will say, well, you might be a human being, but when you're at work, you're supposed to be doing, that's what we're paying you for.
Yeah. Yeah. And so I love that question, because I definitely fully take the perspective of an employer who says, okay, hey, we have a job to do, we have daily operations. And so yes, don't ever make that not important, right? Like, keep the most important thing most important. And for sure, that's to do what you have to do as an organization. But at the same time, if we can find things that integrate with each other, that's the goal, right? So it's not it's about how can we still do what we're doing, not sacrifice business operations by any means, but integrate these different things that will help you. But for sure, when individuals say, hey, no, you want us to change what we're doing and go inside out, it's like, I hope individuals think, no, that's not the goal, right? And if it is the goal to take, if it is a situation to take people, one step away from their work for a certain moment, you're taking one step away from their work to then take 2 steps or 3 steps forward afterwards.
Yeah, that's exactly it, right? It's an investment, just like we would make an investment in our machinery, or we'd make an investment in our innovation. It does take us back to stop and be creative, but it's the only way to propel us forward.
Yeah.
So
And
that,
I don't know, Marianne, maybe you can even think about this and help me understand this one, Dave. I always think if when companies go into a space like psychological health and safety, but their solution or their service, their product, when you think about how does somebody engage with that on a daily basis, and the way they engage with that actually takes them away from their work consistently, I always think like, oh, that's doesn't seem like the most effective thing to do if, yeah, people still have to work, right? I know that sounds super basic, but it's one of those things where, yeah, if we can integrate things, or if we can be like, okay, what matters to you as a company, and then we'll help you get there, which I've heard you say before, right? If we can solve problems in that regard and then integrate what we're doing into what they're already doing and keep their work flow going, yeah, that's a lot different than the solution of, hey, we do this and we take people away from work, or we make them look at this different screen, and we make them during that 8-hour workday not actually like engaged in their work. We want them to engage in us instead.
Right. But when they're engaging with you and with wellness or psychological safety, they are filling themselves up in a positive way, hopefully, so that their productivity, their focus, their energy is better. And that's how the employers benefit from it.
Yeah.
Yeah. So in your corporate wellness work, what have been some of the most successful projects that you have been on?
Yeah. So first one for sure is a mental health pledge. And so I find that in terms of advocating for workplace mental health, what I found is one of the most effective things to do is to actually define what mental health itself is. So there's a definition from the World Health Organization. And so I bring that up because even the mental health continuum is this idea of mental health first and foremost versus mental illness. So mental health is a shared experience of all of us, of course, as you know, Marianne. And so if we can have a mental health pledge, which we did for this one organization, and have it so that people can be like, okay, this goal with this is to just read this definition. And if you're in support of this and how we can make a change together, here's a little digital signature you can do. Nice, simple, that's it. But they're learning about the actual definition of it. They're getting that awareness of it. And then hopefully one day that knowledge and then that skill building. That was like a nice icebreaker that really defined what this is all about and what it's not all about, right? So it's a simple idea of this is the definition. So we're all on the same page, the scope of it, so to say, and then the actual little mental health pledge to show your support. And then we can get a number of, hey, we had X employees sign this pledge, this collective impact of that. It was like, okay, look how many people are behind this. But it was a nice small action with a big, I think a big awareness impact.
That's great. So you're making them aware of the real broad scope of mental health, that it's not just the absence of mental illness, and that it has to do with both psychological, emotional, and social well-being. And that definition just expands people's minds. But you actually got people to sign on and say, yes, we believe this. And I wonder how many people from that point on started thinking, yeah, I need to do more than just say, I can stave off mental illness, which some of us can't, but that they actually started to seek that definition of mental health.
Yeah. Yeah. But it's all about, I think, even if you think about, yeah, the idea of like that cascade of, if we can grow their awareness, then their knowledge, then their skill building. And of course we want to go all the way to skill building right away and behavior change, but at least if we can start with like awareness as our small win there, that's on a macro scale for like an entire company. I think that's a really nice place to start.
Yeah. Now, one of the things that you do, among the many things that you do, is support a course, a post-grad course in wellness. Can you speak a little bit about how that type of education has evolved as psych health and safety has evolved?
For sure. So yeah, Marianne. So I have a part-time faculty position at Centennial College for a post-grad program called the Workplace Wellness and Health Promotion Program. Even myself, I'm a grad of that program from a number of years ago. And so for myself, it's a matter of, okay, if this program impacted myself, giving back to it now and sourcing placement opportunities for students and mentoring students in their placements is very intrinsically rewarding for myself, because I know that impact for a student. Yes, courses are amazing, but if you can have an awesome placement and that can lead to then future employment opportunities, that's something that can really, dare I say, change someone's life, especially if it's in an industry that they're really passionate about, like workplace wellness and health promotion, and how that connects to fields of workplace mental health. It can connect to psychological health and safety and workplace health in general. And so I think what I've seen from it the last few years, how it's evolved, is the idea of, okay, how can we actually act on our knowledge? And so what I mean by that is there's one course in particular that's called program planning. And so it's not about, okay, hey, here's Canada's food guide, or here's the anatomy of the brain in terms of health content. It's about, perhaps you could say, health context, in terms of, okay, we have an initiative right here. How can we actually act on it, and kind of connect it to like project management? So how can we create an operating plan? How can we create a survey? And so that's why there's another course as well on health analytics and digital programs. So it's okay, it's one thing to learn just about health this, or define this, but how do we actually get solutions, and how do we actually create change? And so I think the program has evolved with their courses the last few years.
Yeah, and that's the thing, is that I think at one point, in the way that I say it, is wellness was considered jumping jacks and eating apples. And not that there's anything wrong with either of those things, but that we're starting to see wellness more about the whole person, right? So that we've added the emotional, the psychological, the mental health, and seeing how employers can benefit from that holistic point of view of wellness. So in terms of your involvement now with the technical committee for the National Standard of Canada on psychological health and safety in the workplace, what would you hope will be the evolution of that standard?
My hope with it, and I've heard this from other committee members as well, so I'm excited to put our brains together and create action on this, is how can we make this extremely practical, yet still effective for small to medium-sized businesses?
Mm-hmm.
I think that's like, it'd be fantastic for an organization to say, you know what, we don't have all the resources in the world, but look at like what we have done. Look at how we still stay within our circle of control with employees, and look how we're following different aspects of the standard. I think that would be fantastic, because then even with that, if you can help a number of small businesses like that, and perhaps change can move a little bit quicker through a small business rather than a large multinational corporation, let's say. I think then the feedback you would then get from that, from small to medium-sized businesses as well, would then help with even more learnings for the standard too. So I think that's the single part that's most exciting for myself.
Well, and that's the thing, is that a large percentage, huge percentage of businesses in Canada are small businesses. And there are some benefits, because in small business, you can be much more agile. You can change on a dime. You can decide to switch up things. You can do things with a small group of people that a huge organization would take much more time and process and policy to enact. On the other hand, the larger organizations have the resources to be able to engage in organization-wide programming in a more sustainable way. So there's pros and cons to both, but I agree that the more we can help the small business owner to understand and support psychological health and safety, the more we're going to help Canadians. Yeah.
Yeah.
So I'm excited about that and where it's going to go, and how this standard is going to end up being even better than it is.
Yeah.
So, in terms of COVID and this pandemic, what have you seen, and what are sort of the silver linings that you've seen from this pandemic?
What I've seen, I think I've first, I'll even, if you don't mind, I'll even start on a personal note. Is
Mhm.
what I've seen is the idea that I really have to be in control of my days, or how quickly they can get away from me, right? So even with restrictions and whatnot, it's like you wake up on a Saturday, let's say if you're not working for the weekend, you wake up on a Saturday, and it's okay if you don't consciously say, hey, I'm going to create my day and design my day like this. I think it's all too easy for the day just to get away from you. And then you think, okay, I kind of spent majority of my day on screen per se, that I would have been doing this on a weekday anyways. So it's like you have to myself be really in control. Okay, I am going to go for a walk or a hike today, and I have to like actually set that in stone right now, because my day is just going to get away from me because there's restrictions and there's no other kind of pre-planned events in my day to help guide my day. So I think that's on like a personal level. And I mentioned that because I think that might resonate with some individuals, that it's amazing that if you don't kind of, yeah, put your foot down and say, okay, this is how I'm going to design my day and this is what I'm going to do, it gets away from you, because yeah, again, there's no one else to kind of set your agenda, or no pre-planned events that someone else created that you can go to.
That's
What
so interesting, Nathan, because what you're saying is that you're taking responsibility for your own well being in a way that sometimes I think we might just give up in a workplace and think it's all up to the employer to decide, what it is. We give up our breaks, not because we're forced to, but because we think we should. And then having this pandemic and realizing we could literally sit and stare at a screen 24/7, that we take ownership, take responsibility for our well-being, because inherently, that to be productive, you need to take a break. And this is what I say to employees, is many of them think their employer is saying, you keep working, keep your nose to the grindstone. But in fact, if you're not taking your breaks, you're ripping your employer off, because we know that your focus, your creativity, your quality of work will go down, even though you think, well, I'm dedicated and I'm staying at my desk. It's just true. So that's an interesting observation that you had there. So tell me,
Yeah.
what else? What else has happened through the pandemic?
Yeah, and I think that was kind of on the personal side. On the professional side, the broad point that comes to my mind first is the idea of communication, in terms of when you communicate electronically, email and so forth. What you don't have with that is necessarily tone of voice.
Mhm.
And so I think with the pandemic and whatnot, and this idea of purely virtual communication for an extended period of time, it's this idea of, okay, someone said this, they said it this way, and perhaps misinterpreting something, and then that cascade effect that could happen if you do indeed misinterpret something. So it's the idea of, yes, we're communicating, but those things that, like tone of voice and body language, that doesn't happen as easily through a digital means. And when you do that digital means over and over again for months and months and months, a year or two, okay, there's a little bit of a margin of error for misinterpreting things, I think.
Yeah.
So that's
And
that's
you
the first
realize,
broad part.
yeah, some people have been 2 years almost on a job and they have never met their colleagues face to face. And I have always felt that if I can meet somebody face to face and talk with them, then even their emails make more sense. I hear their voice. I understand who they are. I understand their intention, and I'm less likely to read in aggression, sarcasm, or ill intent of somebody who I've met face to face. And yet, with the pandemic, we haven't. I mean, thank goodness for this kind of communication. It's definitely enabled more than just a telephone call, but it's not the same as face to
Yeah.
face. Yeah.
And then even more specific, the second point about that in terms of, we all work for the same company, let's say, but we're all different, is before, we all went to the same parking spot, or the same parking lot, I should say. And what I mean by that is, okay, you go to the same parking lot, we all work for the same company. But then with the pandemic and for individuals working from home, you're like, okay, we have the same employer, we might be on the same working teams, and sometimes we might have the same job role, but what I hear in the background on a Zoom call, like family members, pets, and what I see perhaps in a home, is a lot different for people. So just amazing how, before, people would become almost we'd have the same idea of how we communicate, and how we go about our how we are at the office, let's say. But at home, we're like, whoa, individuals very much are look how different they are now that we see this sneak peek into their lives at home when we like open up a Zoom chat or a Teams chat with a camera. So I think that's kind of like, wow, we really are different.
Yes, we're different, but I think it also humanizes that
For sure.
in terms of people who are burned out, especially those in leadership roles. I feel that there's a lot to be said for being genuine in terms of reducing stress. If you put the mask on, the armor on every day when you go to work to be who you think people want you to be, it's exhausting. And if you can be not ridiculous or sarcastic or completely off the cuff, but if you can be genuinely you at your best professional best, then it's just easier and you're less likely to burn out. And when I was your age, that was not an option. It was very much, never let them see you sweat. You have to have all the answers. You have to be competent. And the beauty of aging is that you realize that's ridiculous, that nobody has all the answers, that you really can be vulnerable. And I love the way Brene Brown's brought this forward, because I do believe vulnerability is the new courage. And so I'd love to hear, because I know with the work that you're doing and trying to establish yourself, how do you feel about vulnerability in your role?
Yeah, that's a fantastic question. And you're right, because again, it gets at the idea of people working for an organization. Some people might be in a state of, okay, I'm trying to grow my career right now. How do I do it best? And what I think about vulnerability is this something that you have to keep in mind? Yes, without a doubt, right? And I mention that because if individuals can, if you can be more transparent through your vulnerability, they can be that much more, other individuals can be that much more aware of what are your strengths, what are your opportunities, and then therefore what opportunities, or what are your strengths, what are your weaknesses, and then therefore what opportunities can we give to that person. And so I think that's something that myself that I've learned over time, is the idea of individuals, they might know that, okay, intellectually, that you might have, as someone who's growing their career, you might have that ability to be intellectual, to seek knowledge. But now, how can they then, based on how they learn about you through you being more vulnerable, how can they then take yourself, your intellect, and then help position that, again provide opportunities for you? So transparency, I think, can be like, through vulnerability, can be kind of beautiful in that case.
Hmm. Well, and I still say, though, that in a workplace, that it's those who are more secure, more confident, more established that have to be more vulnerable and not to expect the 20 somethings to do it, because we couldn't do it when we were 20 something. And so it is part of that growth and development.
Yeah.
In terms of where you see yourself going next with psych health and safety, where you see employers going with psych health and safety, what do you see on the horizon as we think about life after the pandemic?
Yeah. Two areas come to mind right now. The first is the idea of when there's any sort of, and this again already exists, so we can integrate this, when there's sort of leadership coaching or leadership skill building for organizations, or there's any sort of, okay, we're going to do some sort of workplace culture initiative. Again, these are things I think are they already exist for organizations. Why can't principles from psych health and safety be brought into that? So again, it's not, again, we're not creating something new, we're integrating it within, right? So I think that, and if that can become uh, more frequent and of higher intensity as well, that would be fantastic moving forward after this pandemic.
Well, and like you're saying, that we're just embedding it into the way business is done, just like we had to embed including women in the workplace at one time, just like we had to embed a lack of discrimination into the workplace at some point, not only anti-discrimination policies, but the way that we interact. So I love that idea that we just start to embed psych health and safety in the way business is done.
Yeah, yeah.
What
And
would
second to
be,
that,
oh, go ahead. Yeah.
yeah, second to that is you have the leadership part, and then you have this idea of like total rewards packages too. And then what can we do from total rewards packages, whether it be, we have these different areas of our, let's say, our medical benefits. How can we be more inclusive with this for different aspects of our workforce? And I think using principles from psychological health and safety, and then having in those total rewards packages different solutions for things on the individual side for workplace mental health, and again, services and solutions. I think that would be another fantastic part after this pandemic, if that became more of like the more effective and more efficient.
So explain that a bit. I don't think everybody knows the term total rewards. How is that different than an average benefit package that an employee would have?
Yeah, so I would look at total rewards going into more of, okay, our employee experience. Okay. So we have things like, okay, we have our typical benefits package right now, but for our total rewards, how is even like our workplace culture fitting into that? What about our growth and development opportunities for individuals? And so it's going at, okay, how can we create this? How can we look at, I think, who, and again, this is more stretch thinking, but go about, okay, who is our workforce as a human being beyond their medical benefits, and how can we then make even things like tie in things with their family and family policies and new parents and whatnot? How can we bring that all together? Because we know individuals are more than just, are they, are they ill or not. We can help individuals thrive as well, and that's trying to expand our benefits package to include what people term as total rewards.
So helping people access elder care, helping people access daycare, thinking about the impact that the workplace has on people means that it's not just call the EAP, the Employee Assistance Program, but that we're really looking at the whole person. That's the concept of total rewards. Is that right?
Correct.
Yeah.
And how we even go about that thinking, right, is using something like psychological health and safety to help understand our workforce and what are the different psychosocial hazards that each individual or each team or each department could go through. Because you're right, not every employee is 45 years of age, right? You might have, just in terms of age, you have individuals who are younger that and older than that, and it comes maybe, you know, something like a certain type of family to do policy could be something that's so significant for someone, but wasn't necessarily took into account originally a few years ago, let's say.
Right. Because you're not looking at every age and stage that people are at. You're
Yeah.
just looking at the median, right? And saying, okay, well, we've got that covered. So it's also interesting to me that since we don't have in most organizations mandatory retirement, that we're now looking at many different facets of aging that employers need to look at, and thinking about how to support that in a way that allows those folks to stay productive, to stay energized at work, and not to what somebody called retire on the job. But that how do you do that? And it's not the same as how you would energize, support somebody that is much younger and in a different stage of life.
Yeah. And think about that person who's younger in that stage of life, how to them, how fantastic it would be if a part be again beyond their medical benefits, let's say their medical insurance, they also have this certain dollar amount allocated for continuing education,
Mhm.
and that being a part of the total rewards package as well. And I think that to that person who values that is like, okay, look how amazing and fulfilled I am at work, and then therefore more productive at work as well moving forward.
Yeah, that continuing education is highly valued by a lot of people. Yeah. What other innovations have you seen in terms of either total rewards or changing culture? What have you seen that you think? You did mention the one, which was the mental health pledge. What else
Mhm.
have you seen that you would recommend?
I've seen, okay, so the one that comes to mind right now is this idea of, we have surveys that we've always done as an organization. I'm just thinking third person right now. We have surveys we've always done as an organization. Again, and this goes the idea, perhaps the theme of this podcast, and we can integrate or embed some sort of new questions as well that reflect psychological health and safety. And we're, organization thinks, okay, we've done this survey over the years, but now with last year, with this year being different years in terms of going through a pandemic, we do want to ask these different and new types of questions.
So
So I think
we have
that's,
a,
yep.
yeah, we have a phrase, rush to survey, and where people will ask questions, but they have no plan to act on them, to do anything different. And this can create cynicism. So when you are asking questions of the employees, how do you help the employer to be ready to take action on the results?
Yeah, that's a fantastic question, Maria. And I think perhaps one of the things is an organization to conduct focus groups in order to help understand survey results that much further. This is something that myself, I've done focus groups, haven't tied them to an exact organization survey by any means, but when have done focus groups, it's amazing that what when you actually dive a little bit deeper into what people mean when they say certain types of things, that new perspective you can take on it. Okay, that's what that means. Okay, yeah, now we understand it further. So we're having the target audience help us understand the results that much more, rather than ourselves looking at a spreadsheet or a survey results form and going, okay, how do we now think we know the solutions based on what they're saying. So let's get them to help us understand it better through something like focus groups, let's say. And then that can even funnel down even further to when looking at survey results or doing observational methods, perhaps one-on-one interviews with the target population as well. But I think that's the first thing that came to my mind was, okay, we have this high level or organizational wide survey. We can also do a few focus groups with those who we survey just to help us understand things that much more. And we're getting at both what they need and what they want.
Yeah, I think that's just critical that we ask the employees to interpret their own results rather than making assumptions that we know what they intended or where that came from. And it is interesting listening to academics and researchers talk about the survey instruments and, is it properly measuring this or that or the other thing? And it's like, it doesn't matter what it measures. We need to understand why those results came. What's the experience of the employees that led them to give that answer is more important than whether the measurement is scientifically valid. It's what does it mean? And how can we do better? What would be required to change their mind about the way they answered that question? Yeah.
And I think I remember when I think that became really evident to me through being involved with, as you know, Marianne, with Sarah Jenner for Mindful Employer Canada and the Mindful Leader trainings, where it's the idea of this isn't about, going into a room and saying, okay, everyone, this is how we're going to do it. This is my solution. It works every single time for every organization, every single size. And this is what it is. It's not that. It's the idea of, okay, how can you help us help you, right? It's what does this mean to you? What are your pain points? What is your point of view on it? And then we can come to a solution together. But it's this idea of, rather than a blanket solution coming in right away.
Right. I always say, because I get leaders saying, well, you're giving too much power to the employees and we're the boss. We're the ones that are. And the way that I differentiate it is you're very much in charge of what you want people to do, how you're going to measure that success. But the psych health and safety is allow them some latitude in how they will do it, how they can maximize their energy, their focus, their quality of work, is giving them that, because the way that I might do it might be completely different than the way you do it. But if in the end, we both end up with a high quality product or service or output, then the employer should be happy with that rather than micromanaging how we get our work done.
And what do you think about this, Marianne? I think that funnels to a point I mentioned earlier, for knowing that each organization can be different and different people value different things, in a sense that for some organizations, right, I mentioned earlier, a mental health pledge and just building awareness is very impactful for that organization in particular, versus another organization, okay, if they have a full-on, mental health first aid training program go across the organization, that's what's really impactful for them. That's why no solution is necessarily like each solution can mean different things to different organizations, and one that is okay, that's somewhat of a solution for us, could end up being something that for another organization thinks to themselves, okay, this really helped us out.
Right, because it's starting where they're at rather than just trying to give them this cookie cutter approach saying this is the way you need to do it. You start where the organization's at. In the approach that we're talking about, for instance, you have an organization going through a great big merger and you want to talk to them about a workplace mental health program, and they're like, look, we've got so much on the go. We've got to get these two different companies to come together. Everybody's upset about it. We don't have time for this wellness thing. But if you went to them and said, what's the challenge with the merger? And they say, these two organizations both think they had it right and they don't want to compromise. They are fighting and they're arguing, and people are worried because they know there's going to be some downsizing. Then you say, oh, okay, so I could help you with that problem by engaging the newly constituted teams in some activities that will help them rethink how they work together. So we don't say it's wellness, we don't say it's psych health and safety, but it is. It's just that we're offering it in support of the issue that the employer has right now, rather than saying, well, let's all do mental health first aid right now. Mental health first aid is great, but it is about dealing with someone in mental health crisis. That's not the same thing as what they're dealing with right now. And it would seem to them to be a less effective use of time.
Yeah. Again, just to emphasize, it's this idea of that integration and embedding these topics into an organization's daily tasks and whatnot, but keeping that organization's daily tasks still the most important thing. So you're acknowledging that they have to still operate as a business, and we're not taking that away from them. And I'll mention this to you, Marianne, and everyone listening. This might be interesting as well in terms of, okay, we can let's have some sort of novel initiative, but really it could be a wellness, or it could be a psych health and safety part of it, but more so on the wellness piece of it. Even things like in the workplace health world, this is the idea of the built environment. So it's okay, like even our surroundings, right? Do we have access to sunlight? Do we have our ergonomic setup as well? Air quality, ventilation, so all these different factors with the physical environment that play into our health. That's one of those things too, where an organization can be giving individuals while they're at their home office different resources, like let's say the quickest win with that is some sort of new ergonomic setup, or even in their actual office, they're putting, again, ventilation or air quality, they're benefiting these things, and they're doing this because it's the right thing to do, but they're not maybe going about it and saying, okay, but this is a wellness thing. Well, they're doing it because it's the awesome thing to do and the right thing to do in the first place, versus putting, I guess, to your point, a massive like label on it and a massive banner that says this is for this specifically, and this is why we're doing it. Like we're doing it because it makes sense for our company and it helps us get to our goals and our objectives.
Right. And it's just, as you say, air quality, access to sunlight, those things are going to improve our psychological safety. Those things are going to improve our mental health. So I think that as consultants, we need to not try to ram even wellness or psychological health and safety or mental health down the throats of the leaders. We can give them ways to support what they're doing, and it will also be in support of that. And the language we use can be whatever language they're open to.
Yeah.
So the work that you're doing, wellness, is usually done at the HR or occupational health level. But what's your advice to frontline leaders? So you think about the person on the shop floor, the person in the machine shop. What's your advice to them when they don't have funding for wellness programs? They don't have any control over what the organization does, yet they have impact on the wellness of their employees. What's your advice to them?
I think my advice to them is this idea of we start, and this is a step in and of itself, is we start by gathering feedback, gathering input. But then further to that, I think even in the National Standard of Canada for Psychological Health and Safety, and then even in the recent ISO standard, they actually list out psychosocial risks or psychosocial hazards. And so it's one thing to gather feedback from employees, and in this case, frontline leaders, just by talking to individuals and being like, okay, we're trying to do this. I'm trying to gather this and be like to them, okay, now, give me your impact, give me your your solution, give me. And it's sometimes individuals, they want to for sure, but they don't have they don't have, let's say, the literacy to do just that. And what I mean is that if individuals can say, or you can say to them, okay, and something like an ISO standard or the standard National Standard of Canada for psychological health and safety, these are actually the risk factors. Do any of these come to mind for you in terms of something you want to share feedback with me on, and using that to help guide the conversation? I think that'd be a nice win for frontline leaders, and help add some sort of structure to conversations, which is really what I'm trying to get at with that, is adding structure and context to a conversation.
Yeah, and I'll just put a shout out to the On the Agenda series. And what that is actual materials for a leader to use to have a conversation about each of the psychosocial factors. And it's free on the Workplace Strategies for Mental Health website. So I think that your concept of start where we already know that it has an impact on the psychological health and safety, and have those conversations.
Yeah.
Last question is, how would you describe psychological health and safety to somebody who has no idea what it is, rather than the definition, which Martin Shane and others gave us for it, the formal definition, which anybody can read? How would you describe it to somebody who says, what are you talking about?
I would say in one simple line is, how do we take care of our people? And like, this part of this conversation is that can mean different types of things to different employee groups, but we have different types of tools, we have different types of solutions, and we can use this one, we cannot use this one, we can take a piece here, take a piece here. But this really comes down to, how do we take care of our people? How do we, on one side of the coin, prevent, and then the other side of the coin, how do we promote as well, in terms of well-being and psychological health and safety? So it's, how do we take care of our people? That's the question at the end of the day.
That's beautiful. Thank you very much for that, Nathan. And you will be able to see some short video clips of yourself on LinkedIn just before the episode will air. And anybody can go to the Psych Health and Safety in Canada LinkedIn, to the Flourish DX LinkedIn, or my own. And if I may say, that they can contact you as well through LinkedIn.
Yeah, let's keep this conversation going. Just like myself coming onto this podcast, it's the more people who can continue this conversation, and that domino effect of that, then we can really be like, okay, now we look back and look at everyone talking about this and how much bigger we got just by having more and more conversations about it.